Today's an age of artificial hearts, cancer tests using a patient's breath, and replacement organs made on 3D printers. If you were asked to name an advancement at the forefront of healthcare, the least likely answer would probably be how we pay for it. Yet shared savings, pay for performance, and value-based buying have led to the advancement of the Accountable Care Organization. Today, there are hundreds of ACOs across the country seeking to improve the delivery of healthcare while at the same time reducing cost. I'm Adam Salati, and welcome to this episode of the eClinicalWorks podcast. Joining me today are Chad Johnson, CEO of Children's Health Network in Minnesota, Kelly Lemieux, Pediatrician at Wayzata Children's Clinic and Chair of Clinical Operations and Performance Committee at CHN, and Dave Overman, President and COO of Children's Hospitals and Clinics of Minnesota. Thank you, everybody, for being here with me today. And of course, you're here because you guys are all at the forefront of this Accountable Care Organization and putting this model to work in a pediatric setting here in Minnesota, and using the eClinicalWorks CCMR and eClinicalWorks Community Analytics as well. So who wants to set the scene for us? What is the pediatric healthcare environment like here?
Well, I can take a quick cut at that. We started on a journey about 3 or 4 years ago where we had a PHO, a physician hospital organization, in place for about 20 years, which we were doing some collaboration between our community and the hospital, but it was a very loosely organized situation. And so we started looking at ourselves and saying, how do we really look to the future of healthcare and where that's going, and how do we come together as a hospital system and a community and really able to integrate to really change the way we can deliver healthcare. So that's what kind of started this process, and it's been a journey. It continues to be a journey every day. But we were able to get the hospital together with community physicians and really come together to build this and learn and start to define how we can care for the families and patients we serve in pediatrics.
I also believe there was a huge opportunity for us from a pediatric perspective, as adult accountable care organizations are probably more advanced than the pediatrics world. What we decided is if we would come together as that entity, we would be able to provide the pediatric care inside the adult accountable care organizations. And that's what we've seen as we start to partner with our adult partners throughout the community, is allowing us to be that pediatric arm of their accountable care organization.
Filling that missing link there, where they're obviously able to deal very well with their adult patients, but looking to a specialist like yourselves for the pediatric care. And of course, we have a pediatrician with us here today to provide that viewpoint. So let's talk about the patient's view of this whole thing, because we're talking about it here from an organizational standpoint, but where does the patient fit in to that?
I think the patient is what has driven this network and what has really given us all the energy and the courage to take that leap of faith and come together in a community sense with all of the different kinds of pediatric clinics that we have in our community. And this network has worked to bring together independent primary care clinics, clinics who have formal hospital affiliations, and clinics that are owned by children's hospitals. So within this network, it really gives us the ability to all come together and work together with that same patient-driven quality of care focus in a way that we've never been able to do in the past.
I think one of the things we realized is patients don't just stay in one kind of center of care. Patients are constantly going from a primary care setting to a specialty setting, to a school, to a hospital, to an ER. They move all over, and we as a network quickly looked at ourselves and said, we have to be able to move with those patients and provide an integrated care delivery model no matter where they are in that care model. And that was really kind of the transformation we have looked at and worked with the primary care groups, the specialty groups in the hospital to look and say, how can we make that a reality?
And we just don't serve our patients well if we're practicing medicine in a silo or in a bubble. As Chad said, our patients move around, and they have lives outside our individual clinic or hospital setting. And until we really took this step to move forward and try to integrate things, taking their perspective as what is driving the system, I don't think we were or will have the ability to serve them as well.
How have you been reorganizing the system from the patient's perspective? What are you doing to move these goals along?
Well, I think one of the things we're really focused on is, from a patient perspective, is starting to establish some centralized care coordination models, establishing more engagement with the patients. So from a physician standpoint, we can be more interactive with the patients in terms of complex conditions. We can integrate more directly with their school systems. So we're trying to bring healthcare, not a place where they have to go to get it, but we can bring healthcare to them where they are.
So I think one of the biggest dynamics is if you think about healthcare today, when you enter any healthcare facility, you really relinquish all of your control and follow what those healthcare givers ask you to follow. We're really changing that locus of control that says we really want to meet the needs where you want us to meet those needs. So by starting to put together their individual patient information and the ability to spread that across this network, no matter where you enter, we know you, and we know you as if you were going to your primary clinic. And it is so important to say, let's not start this healthcare adventure over again, depending on what door you entered, and how do we treat you as that individual and patient and family, as opposed to you're now my patient, not someone else's patient.
Right. I think many patients can relate to that. I mean, I know when I ever go to the doctor's office, it's sometimes like, yeah, you're right. Why are we starting this all over again? The computers are everywhere now. Why doesn't this just flow wherever I go?
One of the examples I just kind of go back to is my daughter a number of years ago had to go to her physician, her pediatrician, and they found an issue. And they had to then go see the specialist that same day, and we had to repeat all the same things. It was like another visit with the same tests, same things. Then we'd go to the hospital, and it was the same thing again. And so when I always go back to that model to say, if it was me again today, would we be able to do a better job with that situation so that it was an integrated visit? So when I showed up at the hospital, they would say, oh, I see you've already had this, and we've already had a communication with your other physicians, and we know exactly what to do, and here's the plan. And that's where we need to go for patients.
And I think from the pediatric, the primary care perspective, what the network really enables us to do is we're already on that side where these are, by and large, kids that we take care of from birth through college age. We feel like we really develop and cultivate a relationship with families and with kids, and that we know them best. And what the network really enables us to do is to take that care coordination to a level that, as an isolated, medium-sized private group, we can't afford to do this alone without partnering with a corporate entity like Children's and like the network in order to elevate our resources and our technology and our ability to communicate within the whole network without the resources that this network allows us to have. So, it's a win-win.
We're talking a lot about goals and aspirations and visions for the future, but where are we today? Describe the network. What's the size of the network? How many statistics? What statistics can you give me?
Well, I guess this is my job. Currently today, we have about 660 physicians in our network. About 225 primary physicians, the rest specialists. And that's a combination of employed physicians by the hospital and independent physicians. So we've got a very wide breadth of pediatric clinicians, which is great because we cover so much of the care that's given. So we have a good footprint. And where we are today is we are really out there. We're working with the payer communities to innovate new models to work with the payers to say we can create a win-win situation for us to provide better quality and change that reimbursement model a little bit. We are putting in technologies so that we can actually integrate The data, as Dave talked about, is having that view of a patient, no matter where they are, and we can share that as a community. So we're building the technologies so we can track that patient in terms of providing better quality, more seamless transitions of care, and we're understanding how we operate clinically and financially as a network. Now, we're scratching the surface. There's a long way to go in this journey, but we've got the tools and the pieces in place to really get us started.
And when you say tools, I'm sure you have a wide range of things at your disposal. But of course, relevant to us here today, we're talking about the CCMR from eClinicalWorks and community analytics. We'll get into a little bit more about those a little bit later. But you have so many of these different moving parts. I mean, I've got three of them right in front of me here, and there's others. There's independent physicians, affiliated physicians, specialists, primary care, and of course you have the hospital as well. How do you get all of those parts moving in the same direction?
Lots of coffee. I joke around saying I think I've ingested a couple hundred gallons of coffee over the last 3 years between the hours of 6 a.m. and 8 a.m. meeting with getting out to the physician practices.
And I think we have a thank you card from Columbia for that as well. Yeah.
So, it really is. I mean, it's not a task that just happens overnight. It is something that takes, dedicated effort, and it takes strong commitment from the hospital leadership to have a consistent message, and it takes strong commitment from community physicians that say, we believe in a larger vision, and we believe we can do this together more effectively. And then it just takes a lot of kind of boots on the ground, education, meeting with people, telling your story and sharing your vision. Because if people can't see the vision and see where we could go as a group, you're not going to get the buy-in from it.
The other thing I would share is that I think there is a tremendous respect and appreciation for each one of these groups that plays to the whole. And because we respect each other, we also say, we're not going to compete with them. So from a hospital perspective, I'm not going to go out in the community and say, I want to set up a primary care clinic and start competing with who we look to as our partners. And so I think there's a tremendous respect for what they do and what they bring, and I believe they respect the specialties for what they do. So we have I would like to tell you, I'm not going to sit here and say there's never any competition, but I think there's a great respect amongst our whole community about the clinicians and the work we collectively do, and even more importantly now, the work that we know we could do if we did that work together, truly the 1 + 1 = 3.
And do you trust these guys as a physician?
Absolutely. And it's a journey of trust, because when we started this process 3 years ago, I'm losing track of time, and gallons of coffee. It took a lot of relationship building, because each of the independent clinics and the hospital clinics come to the table with their own culture that they are really looking to preserve, and looking to sustain the ideas and the drive that each of their clinics have developed a history of how they practice medicine in each of our individual cultures. And so I think there's a lot at stake when you bring all that to the table, and it can be threatening at times, and people don't want to give up status quo, and people want to trust that we really are sharing a common vision. But ultimately, I think taking the time to build those relationships, have those difficult conversations, and remember why we are all sitting at this table, which is really to drive our patient care. I think, it works. But it's a process.
I think it's a maybe an overused comparison, but I believe it's a little bit like getting into a relationship. It's at the end of it, you're stronger together, but it takes a while to figure out, and it's kind of scary sometimes because I got to give up some of my independence, and I got to trust that they're going to make decisions that are good for us as a whole. And so it's between a community and a hospital, but it's also about every single clinic practice trusting each other that we're not going to make decisions to benefit me. We're going to make decisions to benefit us. And it's that us against them terminology that has to kind of be wiped from your lexicon, and it becomes a we. And that doesn't happen overnight. It takes some time, but it's that consistent message. And over time, it's been amazing in 3 years how when clinics used to just do it their way, suddenly now clinics call other clinics and say, hey, how did you do this? How can we do this together? And we've really kind of come to a new place of care, of collaborating.
Well, I was going to say, one of the more exciting things, I think, when you talk about where we are now in this process of evolution as a network, is I think we're beginning to see the impact that we can have on driving our own pediatric clinical agenda. And I think to date, because we've been fragmented and isolated in our smaller clinic environments, we haven't been able to come together as a group of 220 primary care physicians and drive a clinical agenda for pediatrics in an adult modeled quality world that is relevant and meaningful to our groups and our practices. And I think that was one of the key kind of driving motivations too, is just to see the impact that we can have as a larger group on talking to payers and national platforms on, we're in the trenches, we take care of kids, we know what we need to work on, and let's bring all that together as one agenda that we really can make an impact on in a meaningful, relevant way. And I think that finding that power and drive in numbers is one of the key components of bringing us all together as well.
Are you able to share any of those milestones? Are there any things that stick out in your mind, or?
I think this morning,
Yeah.
Kelly and myself and some others met with one of our larger payers here in town, and we had a very collaborative discussion with the medical directors from the insurer, their contracting team, and really we talked about as a children's health network, we have defined a clinical agenda that we are going to use for 2015. And so we've defined specific measures. We've defined those measures in great detail, starting with some of the HEDIS measures. We've really done a lot, and Kelly's been one of the drivers on this to define that agenda. But the difference is we didn't do it in a community and then the hospital did their own, and then we tried to say, okay, how do we make this? We brought hospital physicians in quality together with the community, and we brought, clinical nurses. We brought all the people that come together on that, IT people, to help make sure we can measure it. And we developed this agenda, and then now we're going to the payer community, and the payer community is actually very receptive to us having one clinical agenda that now we can drive with all the payers, and then the adult systems who don't have the expertise in pediatrics are wanting to use our clinical agenda as well. So we can now have a uniform clinical agenda that we can all drive toward, and then focus on a very finite set of things that we can really do well.
You can see the trees through the forest or the forest through the trees. I don't know which direction that metaphor goes, but it sounds like it applies here.
I think what we're really seeing in the dynamics here is as everybody works towards accomplishing the triple aim, right, around bending that cost curve, population health, and experience for our patients and families. What you're finding is our ability, if you look back 10 years, the people that really housed the most information was the payers. And so you always had to argue with the payers. What's happening now is we're coming together, and if you want to use an overused term, we're bringing big data to the table. Our payers are actually looking at us right now saying, we would like to give you our data as well, because now we think we even leverage this information more that says, how do we help drive this? Because we're able to start to come to the table with that information, they're also saying, you guys understand pediatrics far better than we do. We're not measured against these adult measures, which just don't make sense. And that's probably been the biggest frustration for us as administrators. And as physicians, it's the biggest frustration that you give me a measure that you hold me accountable to that makes no sense for a child. And so we're really starting to see the attitude on both sides of that fence really shift as a result of us being able to bring this information forward.
So you become more partners in the discussion rather than having somebody give you all of the information.
Yeah, that's exactly it.
correct.
We've noticed that the payer discussions have become much more collaborative and much more productive as they see that we are actually organized now to have a much better data.
And I think the
play.
primary care clinics are becoming more engaged simply because the data is, or the quality measures are becoming more relevant and more meaningful. And I think in the past, when adult measures have trickled down or quality work has been presented to us, it was disregarded and not engaged in simply because it didn't have the relevance that people felt was really worth the time and effort that needed to go into engaging it. So I think being pediatric driven has made a really big difference in the energy and the excitement in engaging the work in
And
the first
physician
place.
driven.
Yep.
The physicians are now at the table developing that quality agenda for what makes sense for them.
Yep.
Wonderful. Well, we're going to take a quick break. We're going to come right back with more from the eClinicalWorks podcast.
eClinicalWorks offers a variety of services for you to take advantage of EBO in your practice as part of its professional services umbrella. If you are a practice looking to get started with EBO, make sure to take advantage of the free EBO webinars on navigation, practice management, and Query Studio authoring. Once complete, look up the EBO class schedule in Westboro and regional offices to take your reporting skills to the next level. If you are a practice that is looking for a one-time engagement with a report expert, consider engaging with a member of the analytics team to solve your unique pain point. If you are a practice that is looking for a comprehensive engagement with a reporting consultant assigned to your account that includes discovery, report authoring, on-site training, talk to your account manager about full suite analytics services. Help eClinicalWorks unlock the value of the data stored in your eClinicalWorks database by using EBO to its full potential. Reach out to your account manager or visit my.eClinicalWorks.com for more information.
Welcome back to the eClinicalWorks podcast. I'm Adam Salati, and I'm joined today by a panel of experts from Children's Health Network in Minnesota, Dave Overman, Chad Johnson, and Kelly Lemieux. And we've been talking about their ACO and a lot of the changes that they've been putting into place. It sounds like technology has played a key role in this transformation. What can we say about that? What would you like to say about that?
Well, I think it's very clear that technology plays certainly a critical piece of what we're developing here today. When I think about our journey, I think about three areas. One is around the people. I think we have tremendous clinicians and tremendous support in place. Very confident we can evolve and really deliver world-class pediatric care. Two, I think about the processes. I think we've got the expertise to build those processes to drive that standardization across this network. The area that had always concerned me, and I grew up in the technology world, was how do you find the right pieces of technology that are going to integrate and really deliver to what we know we need in order to make this evolution. And what we did is we spent a lot of time looking at who not only could do integration today, but who do we really believe had a passion to want to work in the pediatric marketplace and help us develop a pediatric solution that can take us to where we want our accountable care organization to go. And that was critical as we went down this selection process. And as we went through that process, we picked eClinicalWorks for that very same reason, that said, look, they're willing to invest in co-developing what we think could be market changing around how we're going to manage this network through the use of this technology.
We spent a lot of time looking at all the big players out there that for population health, analytics, and we found a lot of people are really good at very specific things. What we didn't find is someone that had the whole vision that we had of what we want to do as a network. And as Dave said, eClinicalWorks came to us and said, we want to go here. We've got the vision, and we right away saw that vision and agreed to that. What they did differently was had the model of a closed loop and said, help us develop it. Instead of us having to fit into their adult models, they said, help us develop that peds. You bring us the expertise, and we'll be to partner with you and give you the resources, the time, and the effort to do it. And it's been a very beneficial partnership over the last year and a half as we've been developing this.
Now, in the beginning, we talked a lot about this care coordination and some of the technology you have been using. So, when did it start? When did you start using the eClinicalWorks CCMR?
So when we really started was probably about a year ago, where we really started focusing on putting together some real processes to use this in a live environment to start managing patients. So the hospital actually was working with the state of Minnesota on a project to do a total cost of care for a population of 16,000 patients. So we were looking at this, saying, well, how do we start looking at how do we manage this group of patients? So we used the analytics tool, the CCMR tool, to load those patients. We were able to look at those patients in ways we've never been able to see before. And our initial assumptions on how we wanted to assign care managers, we found weren't true, and when we really looked at the data. So we were able to use the tool to define a subset of about 350 patients that we were then able to load into the CCMR care management tools and actually start signing care managers and working those patients in real time. And that happened at the beginning of 2014. And so that's been in place now since the beginning of 2014 and is showing some very positive results.
Actually, to give you a sense of those results, there's 6 systems in the Twin Cities that worked with the state on running different Medicaid populations and how do we change that cost curve. And we were the only organization in that first year that actually received the payment of shared savings by actually moving that cost per member per month. And we believe a large piece of that is as a result of the work we're doing around care coordination and how we're identifying the right population out of that 16,000 to really manage and make sure we're out in front of that care as opposed to after the fact.
Is it rude to ask for a number? Does that out of the realm of this discussion? It's okay if it is.
I believe the number was appropriate for the work that we did.
Very well put. I like that answer.
But I think I want to really call out again just how, we both kind of talked about it. If we wouldn't have had the analytics capabilities, we would have picked a different population to manage. And I don't know that we would have been as successful.
We wouldn't have.
So by using those analytics and really defining and understanding that population, we were able to very strategically manage that population, which then gave us the ability to find those savings. So you have to have that full loop. You can't just say we're going to do population health, but only do a part of it. Unless you have that full closed loop of analytics, managing with care managers, patient engagement, and then keep playing that loop over to keep doing it, you're never truly going to be successful in this space.
And then bringing that information to the point of care at the time of care near real time is so critical, because that's really where a lot of these decisions need to be made as a clinician, and what may have been missed gets picked up.
What types of insight did you have before using CCMR and the community analytics into this kind of stuff?
Into the need for the need
into
that
your manage your
existed
populations.
yeah.
And
I was purposefully silent because we didn't have a lot of insight other than
Right.
That was
And
your answer.
That would
okay.
be my answer as a clinician too, is that there's a great need for it. And I think, again, prior to coming together as a network and in these initial baby steps that we're taking to utilize the system more effectively, and get it into all of our realm in the community clinics, I think we're excited and we're welcoming of that ability to do that. We're not quite there yet, but I think as a clinician in the community, the way care management often works in our small and kind of medium-sized clinics is that I am the care manager for my patient, and not unlike other pediatricians across the country, I have my subset of very complex kids who have chronic diagnoses or have had cancer diagnoses and lots of follow-up care in their remission. Or just this week I had a child that was in a bad motor vehicle accident and is still hospitalized at Children's, and just talking to his mom from the hospital to my clinic and trying to help them navigate a healthcare system and arrange follow-up and make sure that her other kids are being taken care of that were in the accident but not hospitalized. It's a lot of coordinating care, and I think that being able to put in place the systems and the support that would help us as clinicians do that work that could probably be as well, if not better, managed by a care coordinator or a different level of healthcare professional, so that I can get back into the room and see patients who need medical decision making beyond care coordination is a great utilization of the system. And I think as primary care doctors, we welcome that support and that ability to all work together and take care of the kids across our systems in a coordinated way.
It's very clear that if you summarize, I believe what EMRs brought us, they brought us some tremendous value. The downside of what they brought us is we collected a tremendous amount of data. What this analytical tool allowed us to do is take that data and turn it into actionable information. And that is so important because we're collecting so much data, but we were unable to use that data as information then to make decisions and change protocols and change other aspects.
You're not drowning under the information, you're using it to drive your change.
We're able to have conversations with that data now to really make meaningful decisions and drive the care. And I think the most important thing too is we are looking at this care management model of a centralized model. So we're not repeating and trying to put care managers everywhere and repeating it, but we can have a centralized model that can act on behalf of our whole network. And we look at that as, there's always some concern about, are they taking the place of a physician? And we look at that and say, no, they're allowing the physicians to be physicians, and they're assisting the physician, not trying to step on toes. And Kelly, I don't know if you...
Absolutely. Yeah, I see it as a support to what we do each day and just helping us to take better care of patients. I don't see it as taking away my decision making or my clinical care for patients. I see it as a tool to help support what we're doing.
And we built the development of that. It's a physician-driven, committee that is developing that care management model as well.
Yep.
So it's made up of employed physicians, community physicians, key administrators, all coming together to say, how do we build this model to support the care that we can do and allow physicians to be physicians?
So we'll take some parting shots here. We've talked a lot about your development up till this point and some tremendous strides we've made, and of course some new roles that have been added in terms of care managers and care coordinators, and how some existing roles have changed and been enhanced as a result, and how that's all tied together with the CCMR and community analytics. What, after all that, is next? What's the vision for the future?
I think it's a great question. I think part of what we're doing right now is we're taking the fabric of the healthcare system, and in a way we're unweaving it. And we're reweaving that fabric a little bit into really integrating much tighter technology, people, exactly what Dave was talking to, resources, process, and technology. And we're looking at how do we really combine those into a very cohesive entity so that we can take care of that patient and influence care at the point of care. An example of that, I'm actually working with eClinicalWorks and one of our clinics on piloting apps that just hand the patient a phone, and that care plan is on their smart device. That's that every day they put in, I took my meds. They put in their glucose levels. Whatever it is that Kelly needs to see with that patient, it gets tracked. Now, a care coordinator sees that patient didn't take their meds for 2 days. I know that could cause some big problems. What happens in real time? They get a notification. Kelly gets a notification. We're now reaching out to that patient in real time and preventing a possible inpatient admission, an ED visit. We're now addressing care and becoming proactive in the care we can provide instead of reactive. That's kind of where we need to go here and continue to have that holistic view of care and bring care to where the patients are.
So we we say it at a broader perspective that we want to be every family's essential partner in raising healthier children. And in order to do that, I think you have to really change this paradigm to become more proactive in partnering as opposed to reactive. And so as Chad talks about that technology, think of another piece of that technology where we can educate. So if you're an asthma patient and pollen count is high, why not, if I'm managing that population, send them a text saying, make sure you limit your outside activity today with the temperature, with the pollen count, make sure you have your inhaler with you. So I think there's so much more we could do to become their partner. And ultimately where you would like to be is you'd like to be the Google for pediatrics. So whenever you got a question about pediatrics, you're going to Google this network to say, this is the network everybody wants to be like. They have figured out how they really partner to raise healthier children.
And I think as a pediatrician, what my vision is over the next several years that this network helps us elevate with the technology, with the care coordination, the level of care that I can provide on a day-to-day basis when I'm seeing patients. That with these tools, I'm going to be able to help patients manage things, manage their problems, their illnesses, their well care, their anticipatory care in a way that is meaningful and day-to-day and timely. I think it's going to be thinking out of the box so that maybe when I'm seeing a well child who isn't all that complex, that I'm not just in touch with them once a year at a well visit, but there are other tools and ways for us to continue to engage our patients in wellness. I think for our ill kids and our kids with chronic disease, it means using the analytics tools that we have to be able to manage their specific disease in a better and more timely way. And I think from a broader perspective of the entire network of all of our physicians collectively, it's looking to really put together a more and more robust quality agenda that's meaningful and relevant. And I think as we take these baby steps and start in with a few initiatives, that it's going to grow to more and more. And I think that the initiatives that we're doing are going to start to become more outcome-based versus measuring processes and measuring individual tests and things that we're doing now.
Fascinating and exciting developments all around. Thank you all so much for being part of the eClinicalWorks podcast. I'm Adam Salati. We'll see you next time.
Thank you.
Thank you.
Thank you.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.